Pericoronal radiolucencies of jaw. Content: Introduction, entities producing pericoronal radiolucency, description of each, conclusion. Introduction: Variation in the density of the structure exert a profound influence on the image. Greater the density of the structure within the subject, greater the attenuation of the X-ray beam directed through that area. Dense object, radio-opaque. Object with low density, radiolucency. Entities producing pericoronal radiolucency, without opacity, without opacities. Normal follicular space, dentigerous cyst, odontogenic keratocyst, unicystic or mural ameloblastoma, amelofibroma, pericoronitis with opacities, COC, CEOT, AOT, odontoma without opacities, normal follicular size. In a radiograph, it is seen as a normal homogeneous radiolucent space around the crown of a developing tooth and is known as follicular space. Dental follicle associated with the impacted third molar has the potential to undergo cystic degeneration and form dentigerous cyst, odontogenic keratosis, and ameloblastoma. However, this may not be a reliable method to know the pathology associated with impacted tooth. Dentigerous cyst. Definition: Dentigerous cyst is defined as a cyst that originates by the separation of a dental follicle from the crown of unerupted tooth. Radiological features: Usually well-defined unilocular radiolucency associated with unerupted tooth is seen. Occasionally multilocular is seen due to bony trabeculation. 3 radiographic variants are observed: central type, lateral type, and circumferential type. And odontogenic keratocyst. Definition: Keratocyst odontogenic tumor is a benign intraosseous tumor of odontogenic origin with a characteristic lining of parakertinous stratified squamous epithelium and potential aggressive infiltrative behavior. It may be solitary or multiple. The latter is usually one of the stigmata of the inherited ovoid basal cell carcinoma syndrome. Radiographic feature: It shows well-defined unilocular or multilocular radiolucency with smooth scallop margin. Scallop margin suggested unequal growth activity in different parts of the cyst lining. The mandibular lesion enlarge and extend to the other side of the bone by crossing the midline. This is the important characteristics of odontogenic keratocyst. Tooth displacement is commonly seen rather than the tooth resorption. Peripheral odontogenic keratocyst shows ossification of underlying bone. Unicystic ameloblastoma. The definition: The unicystic ameloblastoma represents an ameloblastoma variant presenting a cyst. Radiographic feature: It appears a well-circumscribed unilocular radiolucency with sclerotic border, usually associated with impacted mandibular third molar. Ameloblastic fibroma. Definition: Ameloblastic fibroma consists of odontogenic ectomesenchyme resembling the dental papilla and epithelial strands and nest resembling dental lamina and enamel organ. No dental hard tissue are present. If there is a dentin formation, the lesion is referred to as ameloblastic fibrodentoma. Radiographic feature: It appears as well-defined unilocular multilocular radiolucency with a sclerotic border. Pericoronitis. Definition: Pericoronitis is the inflammation of the tissue surrounding the crown of partially adapted tooth. Radiographic feature: No radiological signs are seen when the lesion is confined to the soft tissue. In most severe cases, the signs may vary from localized rarefaction and sclerosis to osteomyelitis with opacity. COC. COC is also known as a gall cyst, and the definition: a cystic lesion in which the epithelial lining shows a well-defined basal layer of columnar cell and overlying layer that is often many cell thick and that may resemble stellate reticulum, and mass of ghost epithelial cells that may be in the epithelial lining or fibrous capsule. The ghost epithelial cells may be calcified. The dysplastic dentin may be laid down adjacent to the basal layer of epithelium, and in some instances the cyst is associated with an area of more extensive dental hard tissue formation resembling that of a complex or compound odontoma. Radiographic feature: Intraosseous lesions show well-defined unilocular multilocular radiolucent area containing radio-opaque mass of varying size. Frequently, displacement of teeth and desorption of the root are seen. The extraosseous lesions show ossification of underlying bone. CEOT. Calcifying epithelial odontogenic tumor. Definition: It is a locally invasive epithelial odontogenic neoplasm characterized by the presence of amyloid material that may become calcified. Radiographic feature: Usually intraosseous lesions shows irregular unilocular multilocular radiolucent area containing radio-opaque mass of varying size, which gives a characteristic snow-driven appearance. The peripheral lesion sometimes shows ossification of underlying bone. AOT. Definition: Adenomatous odontogenic tumor is a benign hamartomas lesion composed of odontogenic epithelium in a variety of histoarchitectural pattern embedded in the mature connective tissue stroma and characterized by slow but progressive growth. Radiographic feature: Intraosseous follicular type. and extraosseous follicular type, and extraosseous peripheral type. And odontomas definition: odontomas are the most common odontogenic tumor, and odontoma is a mixed odontogenic tumor composed of both epithelial ecton mesenchymal component. And two types of odontoma: complex odontoma and compound odontoma. And the conclusion is management and treatment option and conservative management, monitoring and following